Hi, my name is Andrea Gutierrez. I am a student physical therapist with Rocky Mountain University. I have case 5, which is the lymphedema case. So the patient's wound is at the left posterior leg, about 2/3 distal to the popliteal fossa. There are 3 wound beds that form an irregular triangle. The 2 proximal and wound beds are red and granulated, while the more distal wound bed is yellow and red with a weeping yellow-reddish lymph fluid that seeps down the leg. The entire leg has significant papillomatosis that seizes at the medial and lateral malleoli. The distal weeping wound is the largest, circular, and measures about 2 inches in diameter and 4 millimeters in depth, while the 2 top wounds are smaller and drier, with the left measuring about 0.5 inches in diameter and 2 millimeters in depth, and then the top right measuring about 1.5 inches in diameter and 2 millimeters in depth. Possible etiologies of this wound is he could have had trauma to the leg from either the bed frame or a leg rest in the wheelchair. The increased papillomatosis could cause lessened integrity of the leg and the skin of the leg, and then possibly immobility from bed rest at the hospital could cause a pressure ulcer. And then finally, he could be wearing socks that are too tight, or an ace bandage was donned incorrectly, or some sort of compression garment could have caused this as well. So the wound is probably in its acute stage, possibly acute on chronic. The top wounds are granulated, as I said before, and maybe further along in the healing process than that bottom wound that's weeping with that lymphatic fluid. We can identify that there's damage definitely to the level of the dermis because the wound has blood and lymphatic fluid, which blood vessels and the lymphatics are usually found in that the dermis layer. It's also important to note that the dermal layer is important for one of its functions is for infection control, and so it's going to be important for us to be able to have proper sealants in that area so that the dermis can do its function of providing nutrients to that wound bed, as well as protecting it from infection. Some barriers that this patient may have to proper healing is that he has right-sided heart failure with atrial fibrillation. This could possibly affect proper healing due to the low blood flow to these areas because of the amount of swelling surrounding these areas and because the heart is not functioning in the optimal level. Damage to the heart can have a cascade of other problems at the periphery, so clinicians should note signs of arterial or venous insufficiency that may be negatively affecting wound healing or could cause additional wounds. In that, we should rule out possible signs of arterial insufficiency before prescribing compression garments. We should be using techniques of peripheral pulse measurements as well as the ABI tool. So if there's an ABI less than 0.7, we should consult the physician. Another factor that is unique to this patient is that he has sleep apnea. This can affect the healing of the wound as well, because sleep is critical for resetting many systems of the body, including the immune system and the central nervous system. So the loss of sleep has been shown to increase likelihood of infections because there's a lower functioning of that immune system. The subcutaneous fat of his lower extremity is also a factor because there is, it could affect the blood flow to that area, and the available healing enzymes and proteins could be impeded by a lack of space in that area because of that subcutaneous fat. Papillomatosis, the warts and the cobblestone-like bumps on the skin can impede proper healing because they can become wounds themselves, or the crevices that are between the papillae can be a good environment for infections to form. Open wounds is also, if left unattended, can cause issues with healing because of the improper moisture to the wound bed, and it can cause and can lead to infectious agents entering into the wound. We would want to clean the wound, especially the fluid that is weeping down the leg from the bottom of the wound. Mechanical debridement techniques like gently scrubbing with saline solution and gauze or a sponge would be sufficient for cleaning the lymph fluid off the wound. After cleaning, we would want to control the amount of moisture in the wound by allowing sufficient drainage using a foam bandage or hydrocolloid foam pad that can retain the moisture in the wound bed and prevent drying in case that becomes a problem. The foam could also be useful for padding the wound and in case there's a recurrent positional issue that caused the wound in the first place. Covering the wound with an adhesive sealant will be appropriate to prevent any transmission of infection from getting into the wound and then to prevent leakage of nutrients from coming out of the wound. So finally, we would want to add additional dressing over the sealant to further protect the wound as well as assist in moving lymph fluid toward more proximal lymph nodes. As long as we've ruled out peripheral arterial insufficiency with an ABI over 0.7, compression garments would be appropriate for this patient. He may need assistance with donning or doffing the compression garment with use of sock aid or donning slide. So the PT should definitely provide those trainings on how to use them and to provide the resources themselves. Finally, PTs should refer him to a lymphatic or a lymphedema specialist who will provide the necessary procedures of manual lymph drainage to further move that lymphatic fluid to more proximal lymph nodes. Exercise would benefit this patient, especially active range of motion, strengthening, flexibility, and cardiovascular exercise that is appropriately monitored to address the lymphedema as well as the cardiovascular problems. Education should also be incorporated to ensure that the patient is checking their wound regularly and avoiding the behaviors that can create barriers to proper healing. And this would include smoking, neglecting the wound, infrequent checking, certain positions in bed, immobility, and then improper nutrition. So we want to make sure that we monitor that and that he is self-monitoring that as well. 2 measurement goals for this patient that would benefit him with the healing of this wound would be to look at the size and the depth of the wound, as well as the diameter of the legs. This will address both the wound itself as well as the lymphedema of the lower extremity. And addressing that lymphedema could also possibly prevent further wounds down the road. Thank you for listening. I hope this information was helpful. Have a good day.